Good evening. The Chancellor has announced a multi-billion-pound support package to help businesses through the coronavirus crisis. Rishi Sunak said the country is in an economic emergency and now is the time to be bold. He vowed that the government would do whatever it takes to support the economy, with many businesses reeling from the effects of this week's coronavirus restrictions. He announced a wide-ranging package of loans and guarantees worth £330 billion. There'll be a 12-month business rates holiday, and those with mortgages will be offered a 3-month break in mortgage payments. But there was no mention yet of help for millions of people who rent. It comes as the number of confirmed coronavirus cases in the UK rose to nearly 2,000 and the number of deaths reached 71. Our political editor, Laura Kuenssberg, is in Westminster. Laura.
Sophie, very rarely round here is there a day when it feels like the landscape has been totally transformed. But it's clear now, not just because of the measures the government is prepared to take to try to protect the nation's health, but the scale of the measures they believe are needed now to prop up the economy, to protect the UK's livelihood for as long as this crisis goes on. The Chancellor has announced a huge new British bailout, one that would have been unimaginable just a few days ago. And with some businesses fearing the worst, some of them on the edge, planes grounded, even places of worship curtailed, at least for a time, Britain feels like it will temporarily become a different land. Everything seems different now. You can be on your own in the busiest parts of our biggest city. But quiet doesn't mask the worry. Millions are concerned about their health and loved ones too. But instead of shut down, behind closed doors, the centre of government is in overdrive. They're grappling with the biggest job in generations, to save lives first, but to protect how we make a living too.
We must act like any wartime government and do whatever it takes to support our economy.
You can't blame the new Chancellor for looking serious. Just 33 days into his job, here he is announcing a bailout of historic proportion.
This national effort will be underpinned by government interventions in the economy on a scale unimaginable only a few weeks ago. This is not a time for ideology and orthodoxy. Today, I am making available an initial £330 billion of guarantees, equivalent to 15% of our GDP. That means any business who needs access to cash to pay their rent, their salaries, suppliers, or purchase stock will be able to access a government-backed loan or credit on attractive terms.
Hundreds of billions of government-backed loans, 20 billion in grants and tax cuts at the start. Help with some bills too.
For those in difficulty due to coronavirus, mortgage lenders will now offer a 3-month mortgage holiday so that people will not have to pay a penny towards their mortgage costs while they get back on their feet.
Can you guarantee to firms who need to pay wages now and families who worry about paying the rent now that they will not lose out while you work through the details of what comes next?
Be in no doubt that the state is asking people to do something to make very considerable changes to their lives, and it is only right, therefore, that the state should stand behind people as they make those changes.
Business, big and small, might not have the luxury of time. The office of this Brighton travel company is already practically empty.
I don't think Boris Johnson realises that people are losing their jobs right now. We've had to put staff on unpaid sabbatical with no certainty of what's going to happen over the next few months.
Are you doing enough to stop the virus?
Ministers have been scrambling to find a response big and fast enough. It might sound astonishing, but even more than £300 billion might be just the start. The support plan's huge, but there could still be holes.
What support will individual families get? Will they get sick pay at a level that they'll be able to ensure they have a decent quality of life? Will they get proper support if they're laid off? Will they be able to afford their rents? Will the increases in fuel costs and other things be covered?
But the scale of this, the reality of how many lives may be lost, is hitting home.
Every year in seasonal flu, the number of deaths is thought to be about 8,000 excess deaths. So if we can get this down to numbers 20,000 and below, that's a a good outcome in terms of where we would hope to get to with this outbreak, but I mean, it's still horrible.
By the government's own admission, this is now an economic emergency. So they've just promised to take vast steps to try to stop that turning into individual hardship for millions in the coming months, taking on long-term costs for the country to try to stop a heavy and painful cost being paid by families in the coming months.
The need for help for the country's health and the country's wealth is acute. Reassurance is not a currency in itself. Laura Kuenssberg, BBC News, Westminster.
So billions of pounds worth of loans will be available from next week to help businesses pay for supplies, rent and salaries. The Chancellor said that if these measures were not enough, he would go further. Our economics editor Faisal Islam looks at the new measures in detail and asks if they'll be enough to prevent businesses going under.
In Manchester, preparations for what should have been a busy St Patrick's Day went on this morning. Local businesses contemplating ruin from the government's advice to help stop the spread of the virus by not going out.
Telling people not to go to bars and restaurants and not giving us any support at this point of the day is a real noose round our necks.
I'm sorry, but it's that point of just tell us.
The word recession doesn't quite capture the effect on the pub industry and others of clearing the streets of major cities of actual people.
We have never faced an economic fight like this.
But by late evening, the Chancellor had fundamentally upped the size of the life jacket for the entire economy.
Amazing. That's a real pressure for us because we're like over £50,000 our rates, so that's really good for us.
Coronavirus is now a reality for the whole country, but the theory behind today's interventions is that in some months' time the epidemic will pass and the economy will grow again. This is a bridge, not a bailout, and that is why the support, which promises to do whatever it takes, lasts for months, not years. There's £330 billion in government-backed loans of up to a year for all sizes of business to fund cash flow for wages and suppliers. There's £20 billion in cash grants and business tax cuts, and everybody that needs it can have a 3-month mortgage holiday. These huge amounts reflect the fact that in the next few months a large chunk will be taken off the UK economy. Car production suspended here today at Nissan in Sunderland and in most European car factories. The retailer Laura Ashley went into administration today blaming the virus, though it has had its own challenges, illustrating the problem for the government about whether all firms should get cheap loans. Back in Manchester, a chef at an art centre that has closed is wondering what happens to renters too.
It's scary, you know. People in there, they don't know what to do. They've got mortgages, they've got kids to think about, rent.
So there will be many other forms of support that will be required to keep the significant promise made in Downing Street today. Unthinkable a month ago, unavoidable now.
Faisal is with me now. I mean, the measures that have been announced today are on a scale that we've just never seen before.
These are huge sums, and you can forget about the numbers in the budget book less than a week ago. And that's because when you shut down cities, when aviation is grounded, the impact on the economy is not fractions of a percent, it's fractions of the entire economy. And that's why the response has to also be worth a sixth or a seventh of the entire economy, as this would be in terms of loan guarantees and cash handouts. It's hundreds of billions. There is a risk that these loans might not be paid back, higher than we've in other types of scheme like this that we've had before. It's in line now with what the French announced yesterday, Spanish announced, and a bit more than what the Americans announced in terms of the size of the economy. A significant move indeed. And it's not. I see it as more of a bridge than a bailout. It's designed to get into the minds of business owners and say to them, yes, your cash may be running down because your customers aren't there, but just think that you can get to the side of this valley and carry on paying your workers. And if you get there, we can provide that bridge for you.
And if you are one of these businesses that already is on its knees, I mean, how will this work? What will they do?
So it depends on the size of the company. Sort of small and medium-sized companies sort of operate through the banking system essentially, and through banks, and they'll be supported in turn by the Bank of England and the Treasury. For bigger businesses, it essentially is that your cash would run down, and then you get an overdraft via selling an IOU to the Bank of England, and if that wasn't paid back, the Treasury would repay it. That's the mechanism, a bit complicated, but that's how you do these sort of things. Doesn't cover renters yet. The mortgage guarantee, obviously, because it's a mortgage guarantee, doesn't cover things like support for self-employed, but I'm told that this is a down payment. More will have to come if you want to meet the promise of whatever it takes.
Faisal Islam, thank you. Well, meanwhile, all non-urgent operations will be cancelled in April for 3 months to free up 30,000 beds for the NHS in England. Scotland has taken a similar decision already. Our health editor Hugh looks at how prepared the NHS is for a growing number of severe cases.
Right, Bolton Medical Centre, Cherry speaking.
Preparing for the new realities. This GP surgery in Bolton is urging all patients to stay away if they possibly can. Consultations will now be carried out on the phone and on video link.
Does that tell us you will have to self-isolate 14 days?
We are sort of being very proactive, so we're keeping patients informed. This morning, we're triaging everybody if they're queuing up outside to, why have you accessed the surgery? Please try and phone up, don't come to the surgery.
Some medical students are volunteering to move to the front line.
The final year medical students will hopefully be working in the ward areas, and this is to free up staff that can go onto the front line in places like intensive care.
Some medical staff are frustrated they're not getting tested for the virus. Sandra, who's a nurse, had a sore throat and today was asked to stay off work.
They could do a swab that will take 5 minutes, 2 days for the results, and confirm whether I actually have coronavirus or whether I don't. And I could just go back to work if I didn't.
But as it is, what's happening?
I'm going to have to stay at home for whatever it is, whether it's 7 or 14 days either way.
NHS England is ramping up preparations for virus cases, cancelling all non-urgent operations from next month, freeing up 30,000 beds. Some staff have said there aren't enough ventilators for intensive care and inadequate supplies of protective equipment. The head of NHS England told MPs those concerns were being addressed. He was asked whether the government's measures would be enough to prevent massive pressure on the NHS.
Well, those measures will certainly make a big difference and in our view were absolutely necessary. But frankly, we're going to have to keep this under review. And if it turns out that further measures are required in order to reduce the number of people who get this virus, then that will be something that policymakers and government will have to consider.
Thousands of patients will now have to wait many more months for operations and appointments.
Well, this plan that's been published for the NHS today is a pretty drastic plan, but then we are in exceptional times. This is the biggest challenge that the health service has faced since its creation, and in fact the biggest challenge that we've faced worldwide.
Postponements are already happening. Andy told us about his 8-year-old daughter missing out on reconstructive surgery in Bristol after cancer.
This is devastating. We got some good news that we think the surgeon has removed all the cancer, but now we were hoping the treatment's going to come to an end, and this is left open-ended.
He's now been given a new date for his daughter's operation. Many more won't be so lucky as the NHS has to focus relentlessly on the coronavirus threat. Hugh, BBC News.
Our medical correspondent Fergus Walsh is here with me now, and this freeing up of 30,000 beds gives you an idea of what the NHS is expecting.
Absolutely. It means 3 in 10 of all hospital beds are being set aside ready for coronavirus patients. And although most of us will get a mild illness, thousands may need intensive care. Now, the hope is that the measures that are being taken will keep the predicted death toll to under 20,000. That's a huge number, but it roughly equates to a very bad season of winter flu. But it would only be achievable if those restrictions proposed by the government go on for months.
And there's been some confusion about what we are all expected to do. Can you clarify the instructions?
Yes. So if one person in a household has symptoms, then the whole household stays at home for 14 days. But the biggest advice on top of that is that all of us should stop non-essential contact with others, no social mixing, and that applies in the home too. No getting friends and extended family, grandparents over to celebrate Mother's Day. That goes against the advice. and it applies particularly to the over 70s, pregnant women and those with underlying health conditions. And by the weekend, there'll be 1.4 million people at highest risk, people who've had chemotherapy, who have very hard to treat asthma, cystic fibrosis, who will be asked to self-isolate for 12 weeks.
Fergus, and what is going to happen if we don't comply?
Well, if people simply ignore what is advice and keep going to the pub, and the numbers of cases don't start to fall in a couple of weeks, then what is currently advisory could, in theory, become compulsory, as we've seen in other countries. Nothing is off the table.
Fergus Walsh, thank you. Well, the Foreign Office has made the unprecedented decision to advise against all non-essential travel to anywhere in the world. It said countries could shut their borders with no notice in response to the pandemic. The European Union has banned non-EU citizens from entering for 30 days. UK citizens are unaffected. Here's our transport correspondent, Tom Burridge.
Confusion and a very long wait at Marrakesh airport.
We've just been in a 5-hour-long queue
as people like Amir try to get home.
We've got to the front of the queue and they've said there are no flights. They won't tell us any more details. They don't know any more details. They don't know when they're going to get us to the UK. They don't know when the flights are going to be. They've told us to just wait in the airport.
All flights scheduled to leave Morocco have been suspended, so it's a scramble to get on rescue flights back to Britain.
Hello, my name is Beth. I'm a UK citizen, currently stuck here in Morocco.
Beth unclear when she'll get back to her job in the NHS.
We've been told that we will get a rescheduled flight for August, for April. That is no good. We do not know how this pandemic is going to pan out, and we need to get home, and they have a duty of care to get us home.
We will do everything in our power.
But the government says repatriating most people is down to airlines.
SCO teams around the world are working urgently to ensure that governments have sensible plans to enable the return of British and other travellers, and crucially, to keep borders open for a sufficient period to enable returns to take place on commercial flights wherever that's possible.
In Cusco and other parts of Peru, British tourists like Lauren are stuck.
I can't get out of Peru. They've cancelled all flights to get out of Peru.
The country is in lockdown.
It's very, very scary, mainly for the fact of if it's just a 14-day lockdown, it's not very pleasant, but okay to get over. But the uncertainty of not knowing what's going to happen and the fact that we can't leave the hostel.
Stephen's in the capital, Lima.
We're worried about potential social unrest as kind of supplies run low. We haven't got any food, so we're going to have to go to the supermarket shortly. We're young and healthy, but of course we're also worried about what happens if we get sick.
Tom Burridge, BBC News.
This evening, it was announced that no new jury trial in England and Wales should start unless it's expected to last for 3 days or less because of the dangers posed by coronavirus. All cases estimated to last longer and due to start before the end of April will be adjourned. Trials currently underway will proceed in the hope that they can be completed. And the Euro 2020 football tournament, which was due to be played across 12 European countries, has been delayed by a year. The postponement could provide an opportunity for domestic European leagues that have been forced to suspend this season's games to complete their competitions in June and July. Despite all the turmoil, schools remain open, but for how much longer? The Prime Minister said he was keeping it under continuous review. The largest education union is urging the government to close all schools at least for some time. Here's our education editor, Branwen Jeffries.
Making hand-washing fun, trying to keep them safe, but schools say they are struggling. Teachers are anxious too.
It does seem that everyone else is asked to socially distance except for children at school and also the teachers and the staff.
At this school, they are 3 teachers down already. By tomorrow, classes may merge, and staying open looks increasingly doubtful. The government says that for now, keeping schools open is the right approach. But with everyone else being told to avoid crowded places, it's left many teachers and parents confused, and some families are simply keeping their children off school.
It's down by about 30%,
and still falling, and I can understand why parents are concerned.
While they keep lessons going, head teachers want advice that keeps up with reality. Some schools are already partially closing. So what would a school closure mean for parents here?
At the moment, I'm actually able to work from home. My partner isn't yet at that stage where he can with his job, so it would be tricky for us.
I've already started stocking up on activities and things to do, so they've still got things to do. But for me, I'm lucky. There's lots of people in the school, friends of mine who are working, and it's going to be harder for them.
Closing schools would be a massive step, one the government says it's not yet ready to take. Branwen, BBC News.
The dramatic escalation in restrictions on our lives were partly prompted by research from a team at Imperial College London who said this was the worst respiratory virus since the Spanish flu pandemic in 1918. They warned that Britain was on course for a catastrophic epidemic and the number of deaths in the UK could reach 250,000 unless there was a new approach to the pandemic. Here's our science editor, David Shukman.
From the start of the outbreak in Wuhan, there's been a huge research effort behind the scenes. Scientists using every detail to develop a computer simulation of the disease, what's called a model, and it's what the British government's initial response was based on. But then came northern Italy, where more people need intensive care than anyone expected. So the forecasts have had to be adjusted. What the scientists realised was that as many as 250,000 people could die of the virus in the UK, unless policies here changed. They now hope that'll fall to 20,000 with the new measures announced yesterday.
There's new data emerging from Italy and now from our intensive care units here in London to suggest that the level of treatment that's required for a small fraction of these cases is more intense than we thought.
We keep hearing about the modelling of the outbreak, but what does that actually mean? Well, it's basically maths, calculations about different factors that influence the disease. This model was for Wuhan to work out the rate of infection. It's how scientists quickly found out that on average, every person who gets the virus can pass it on to at least 2 others. So over a month, one case can lead to more than 200. China has responded by closing off entire cities. Other countries have done the same. But until now, the UK has kept the most drastic measures in reserve. So critics have questioned the modelling of the outbreak in Britain. But the scientists doing the work say it's better than nothing.
Models are not crystal balls. They're better than just guessing, which is what you would otherwise have to do. But they're reliant on the data we feed into them, and there is lots we don't know about this virus. There's also lots we don't know about what the effectiveness of these interventions really will be.
So how effective are these computer models of the outbreak? Well, they have to rely on a lot of assumptions about things that aren't known, such as if people have the virus but don't show symptoms, how easily can they pass it on? And then a really critical question: if someone's been infected with the virus and then gets better with a full recovery, is it then possible for them to get it again? Chinese television reporting on research into a possible vaccine. That won't come soon, but it's part of a frantic search around the world to understand the virus and to minimise its impact. David Shukman, BBC News.